Hello and welcome. My name is Megan McCulley, and today I would like to discuss with you the importance of choosing medical devices that best support our nursing staff and how that, in turn, supports our patients. At Ohio Health, our mission is to improve the health of those we serve. Inspired by recent changes to vascular access management protocols, I believe Ohio Health can go one step further. By switching to BD Max Plus and BD Max Zero needle-free connectors, we can guarantee the health and safety of our patients. When talking about the best choice of needle-free connectors, it's important to know the terminology. You will notice both Microclaves and BD Max have needleless connection capabilities to eliminate the possibility for needle stick injuries. Next, you'll see the term displacement. This refers to the fluid movement within the IV catheter. Microclaves have a neutral displacement, which stabilizes the fluid to prevent blood from entering the catheter. However, blood and particulates may still enter if not properly disconnected, causing the line to clot off, necessitating clear housing to confirm that the catheter is unclogged. BD Max needle-free connectors have positive displacement, which pushes fluid out of the lumen to ensure there is no blood in the tip to cause a clot. Septum versus flat sealed surface. The split septum inside the microclave is designed to re-seal after disconnecting from the catheter. However, this design has gaps and holes on and around the tip that allows for the presence of bacteria and the potential for colonization. BD Max needle-free connectors have a flat sealed surface to guarantee bacteria does not colonize on the tip of the connectors. This design permits a lower disinfection time of 3 seconds compared to Microclave's 15 seconds, allowing for nurses to work more efficiently and provide a safer care to our patients. Nurses are the foundation of any hospital system. Oftentimes, they're met with complicated and seemingly impossible tasks that they triumph over. According to the National Council of State Boards of Nursing, 100,000 nurses resigned during the COVID-19 pandemic, causing instability within many hospitals. Vacancies in nursing staff can result in inconsistencies when training newly graduated nurses, leading to a potential increase in negative patient outcomes. When referencing negative outcomes in needle-free connectors, those include central and associated bloodstream infections, or CLABSIs, and occlusions. CLABSIs are potentially life-threatening infections directly attributed to the presence of bacteria in the central line. Occlusions happen when the line clots off or occludes due to blood or particulates present in the line. This requires a dose of clot-busting medication called Alteplase to restore function. Now, taking what we've just learned, let's visit infection and inclusion rates of each brand of needle-free connectors. As observed by V.R. Lang in the research paper Use of Different Needle-Free Connectors, the rate of CLABSI per 1,000 central line days is 1.32 for BD Max needle-free connectors, which is less than half the rate of other NC brands. This is due to the sealed surface of the connector as it helps prevent contamination and decreases disinfection time. This disinfection time drops from 15 seconds to 3 seconds, which is significant in the nursing field as every second counts. For occlusions, Lang observed a rate of 1.51 per 1,000 central line days. For the BD Max needle-free connectors, almost a third of other NC brands. Positive displacement clears the lumen, ensuring it is free of blood and particulates, rather than the neutral displacement of microclaves that may still reflux blood into the catheter, causing it to occlude. If an occlusion occurs, it increases the risk of infection because the line must be opened to push Alteplase or replaced if the line fails due to the occlusion. The BD Max needle-free connectors have a significantly lower infection and inclusion rate, which in turn produces positive outcomes for the patient and the hospital. Haddadin wrote in his book that nearly all CLABSIs were due to bacteria present on healthcare providers' hands, making the hospital liable for the total cost of treatment and stay for the patient, which runs on average $48,000. When blood or particulate clot off the catheter tip, 2 milligrams of Alteplase is pushed through in hopes to restore function. This dose can only be repeated once. If Alteplase fails, the line may need to be replaced. Each time the line is accessed to push the medication or replace the line, it increases the risk for potential negative outcomes and cost for the hospital. Doctors West should choose an efficient product. BD Max Plus and BD Max Zero needle-free connectors have a flat sealed surface that allow for lower disinfection time. positive displacement that clears the catheter of blood and particulates. In VR Lang's research, he stated that the difference in infection and inclusion rates of needle-free connectors is marginal when handled properly. However, there's a national nursing shortage and a growing patient population. That is why it is crucial for Ohio Health Doctors West to choose a product that supports our nursing staff and our patient population. I am certain that product is BD Max Plus and BD Max Zero needle-free connectors. Thank you so much for taking the time to listen to my presentation. Cheers.